The Government of India, through the Ministry of Health and Family Welfare, have recently put on their website a set of guidelines for comments from people. These guidelines talk about withdrawal of life-sustaining therapy for patients who are terminally ill. The guidelines are based on the 2013 judgment by the Honorable Supreme Court, which actually laid down the process for withdrawal of life-sustaining therapy for patients who are terminally ill and who have absolutely no foreseeable future of recovery or death is imminent in them. Now, what was happening up until now? Up until now, because of the lack of such guidelines, often patients were basically being kept on life-sustaining therapy like ventilator, like vasopressors or dialysis until the heart stopped one day, and despite resuscitative measures, the patient could not be revived and was declared dead. Or there were a group of patients whose family member would take up the decision and would basically take the patient leave against medical advice or discharge against medical advice, often away from the eyes of the hospital to their home, and the end would still be imminent and the patients would pass away at home. Now, all of this was not in keeping with the dignity of dying, and the Palliative Care Society of India and the Indian Society of Critical Care Medicine both came out with end-of-life care guidelines, which the Supreme Court actually took into consideration while giving this judgment. What does the Supreme Court say, and what does these government guidelines actually talk about? They are there to safeguard the doctors as well as the patients. Let's take it a little bit more into close understanding. First and foremost, it actually allows the doctors, the patients and the hospital administrators to be on the same page. So that's where the communication channels open up completely. Secondly, a set of 3 doctors, which is the primary doctor and 2 subject matter experts with at least 5 years of experience, examine the patient independently. And then if they come to a consensus that there is complete futility in continuing care and death seems to be inevitable, or this is a terminally non-retrievable situation, they would then go and discuss their findings with the family. And only if the family agrees to their findings, a secondary committee is set up. So the primary committee comes, does the examination, speaks with the family. The secondary committee again consists of 3 more doctors, of which one is appointed by the CMO. CMO as in the District Chief Medical Officer. In metropolitan cities like Mumbai, for example, it will be the Director of Health Services who would nominate this person. This person could be from the same hospital or could be from an independent hospital as well. And then again 2 subject matter experts. Both the committees should have different set of doctors, so you can't have overlapping doctors there. The second committee is required to give their judgment and their clinical findings within 48 hours. So they come, they do an independent assessment, and if their findings concur with the primary committee, they will go and discuss their findings with the patient's family regardless. And if all the 6 doctors have got an understanding that this is a futile situation to continue and the family agrees to it, this should be documented into a correct document in the hospital notes, in the patient's notes, and patient's life-sustaining therapy can be withdrawn and palliative care efforts or comfort care efforts can be started. So you are actually not stopping treatment, you are just changing the goalpost from being aggressive for a futile therapy to actually going for a comfort care so that the dignity of death, dignity of dying is held. I think these guidelines will actually pave good road ahead for people who unfortunately had no way forward when they were stuck on a ventilator or life-sustaining therapy. And this will allow some amount of dignity for death and dying. Not to say the financial burden which they were going through, as well as the resources of ICU bed, which could be a precious one in a public hospital system, could be utilized for somebody who may have a chance of recovery. So guys, look at this in a positive way and think about it. Thank you.